So this is week 3, and this is the week that we're focusing on searching the literature to find evidence to answer our PICO question. We spent last week really focusing on what is a PICO question. We looked at background and foreground questions. We talked a little bit about choosing the type of PICO question, whether it's an intervention, a diagnosis, a prediction, or a meaning question. And you did some practice on trying to turn a clinical problem into a researchable question. And this week, we're going to take that PICO question and use it to help us search. And you're going to realize that you're actually going to use parts of the PICO question as keywords in your search. We talked a little bit last week about how there are barriers that can interfere with nurses, especially nurses at the point of care, really using research in their everyday practice. We talked about them perhaps not being confident in their literature searching abilities, may not be familiar with the databases, how to use the databases. They may be overwhelmed by how much literature is actually out there. Apparently, the amount of articles increases by thousands per hour. And we talked about time. You know, when you're busy and you're working 40 hours a week, you don't necessarily want to spend another 20 hours a week researching articles about your practice. But we've also talked about how the baccalaureate nurse is expected to practice evidence-based nursing care. And so you need to be aware that there's evidence to support what you're doing. So we're going to go into the searching process and hopefully demystify it a little bit. I have several slides that I'm going to go over, and I've also posted learning outcomes for the week that you should look at, and 2 YouTube videos done by an academic librarian on how to search as well. So with that and with the 2 articles I posted on searching for evidence, I think you should be able to have a pretty good handle on the search process. So we are searching the literature so that we can answer a clinical question. And we want to find the best available evidence, the best evidence out there. Next week, we're going to talk about how to appraise the evidence to figure out if it's good quality evidence or not. That's your next step. But this week, while you're beginning your search, you want to sort of prepare yourself for finding the best that's there. And according to the hierarchy of information resources, the best possible literature that you can find to support or answer your question is literature that's been pre-appraised. And that includes systematic reviews, integrative reviews, meta-analyses, metasyntheses, and critiques of single studies. So those are definitely the best possible evidence, and we're going to talk about where you find that kind of evidence. But the caveat is that because this is such pure scientific evidence, there's not a lot of it there. And depending on what your clinical problem is and what your question is, there may not be a systematic review done yet. There may not be enough evidence out there for someone to have pre-appraised it yet. So as you go further in your education, if you go on for your master's or your doctorate, you're definitely going to get more detailed about how you search and what you search for. I think at this point we want to sort of stick with just gathering evidence and practicing appraising that. And I told her I wanted you to focus on the CINAHL database because that is the best database for nursing literature. It's not the best database to find pre-appraised literature. So if you want to practice looking for metasyntheses or systematic reviews, then by all means go to the Cochrane database of systematic reviews. Um, but that's more of an advanced level of search. What those systematic reviews are basically an author or authors decides that they want to look at all the studies that have been done on one particular topic and appraise those studies and then write about it. And that's what a systematic review is. It's highly uh, sort of critically done, follows specific guidelines, um, provides copies of every step of the process, printed copies, how the search was done, how the studies were included, how were they excluded, how were they appraised, how did they appraise. It's a very rigid document. It's actually like a little study. It's a mini study on a bunch of studies. And it's actually what I'm doing now. I'm actually in the process of writing one for school. So it's definitely a higher level type of project, but it's good to at least know what it is. The hierarchy of information resources is often depicted in a pyramid, and at the bottom, what is considered the least reliable evidence is original studies. However, original studies are research, you know, really often timely, um, lengthy, protracted studies that are well done and take years sometimes to complete and then get published. And that's actually considered low level evidence. Actually, to complete my PhD, I have to do an original research study, and it's going to take me probably a good year to do it. And if it gets published, it'll be considered the lowest level of evidence. So, but my point is, it's still good evidence. Depending on how well I conduct my study, it could be an excellent source of evidence. So you can see that that's the lowest level. But for the purposes of this evidence-based practice project, I'm happy if all your evidence is original studies. That's going to be fine. If you want to look for a systematic review or a meta-analysis or metasynthesis, by all means, go for it. And if you find one, great. That's a better level of evidence. But remember, this project is really a learning process for you. And so getting the absolute best possible evidence isn't absolutely necessary. If and when you move on to participate in evidence-based practice projects in your workplace, then you'll have, a solid basis for knowing how to do a more advanced search. This slide just shows a more specific, more detailed hierarchy, and I kind of squiggled out the bottom two because you often don't find studies that are just looking at one case report. Sometimes a physician will do that if they say they treat a patient with something that's unique or they don't see a lot. They might write it up. They might write up a research report on this particular patient they saw because it's going to be of interest. But it's really one person. It's a study of one person, and that doesn't really help build a knowledge base of evidence. And the same thing with a case-controlled study. It's really just more controlled. It's like knowing that you're going to study this case, so you control for it. You're probably not going to find those kind of reports in your study. But a cohort study is when someone, will be probably something like I'm going to do when I do my study. I'll get a cohort of people. I'll determine what my population of interest is, and I will somehow select, um, my sample, um, and and then I'll do my study. So I'll have a certain number of people in my study, and that'll mean that my findings will be somewhat generalizable. We talked a little bit about a randomized controlled trial is when you make the criteria for the study a little more rigid by um, randomizing your sample. So having no preconceived selection process, just randomly taking people. And that makes your study more valid because it doesn't inflict any bias into the sample. If you just put everyone's name into a hat and pull names out, then you aren't biased on who gets into your study unless you limit whose names go in the hat. Controlling means that you're controlling for variables that could affect the results of the study. In other words, I think I talked a little bit about this in class. I said if you were looking at what secondhand smoke does to, what the effects of growing up in a home where you're exposed to secondhand smoke is, you'd want to control for other variables like making sure the person you're studying also doesn't smoke. Because if you're looking at the effects of secondhand smoke, then you would want to make sure that the study participant didn't themselves smoke. So you'd control. So you'd make sure you had non-smokers in your sample. If you wanted to look at a particular age group, you would control for that because if you had um, a young child who hadn't been exposed to secondhand smoke as long as an older person, then that would affect the results of your study. So randomized controlled trials control for variables that can alter the results of the study. And then we already talked about the systematic review and the meta-analysis. This is just a table from one of the articles that is assigned for reading, which looks at the difference between filtered and unfiltered resources. And it really boils down to a clinical guideline is a filtered resource. The National Clinical Guideline Clearinghouse is a great resource to find clinical practice guidelines on, say, managing asthma in the outpatient setting or inpatient setting, managing, different types of cancer. What is the current clinical practice guideline on treatment of, neuroblastoma or whatever? And so the guidelines are produced after an evidence-based project. So after someone has looked at all the evidence, then they develop a clinical practice guideline. So they're filtered. You're going to be really looking at unfiltered resources because you're going to be going into databases. And so I don't want you to get too hung up on filtered and unfiltered. It's just another way to describe the kind of evidence that's out there. The databases that are commonly used are Medline, CINAHL, and PsycInfo. For example, there are definitely lots of others. I told you I want you to really focus on CINAHL. Medline is good. The reason you can use Medline if you want, and you can use PsycInfo if you want. I actually, when I do my lit searches, I have to use PsycInfo because I'm really focusing on behavioral health issues in my research study at what I'm doing. So I have to include PsycInfo, and I actually also include a database called SocIndex, which is like a social studies kind of database because I'm looking at sort of environmental and family issues in my research. But the reason I want you to focus on CINAHL is because it's great. It's a great database, and all nursing studies are in there, unless part of the research team was physicians, and for some reason it didn't end up in CINAHL, but they have very similar, types of studies. In other words, if it's in Medline, it's probably in Cinol. If it's in Cinol, it's likely to be in Medline. For the pre-appraised evidence, you'd look to the Cochrane database of systematic reviews and some of these other databases. I definitely use the National Guideline Clearinghouse. I use that a lot, especially in my practice as a nurse practitioner, because I want to, depending on where I work, working in an outpatient setting, you often don't have access, just like we talked about, some of the barriers to evidence-based practice. I find that in, outpatient settings, they definitely don't have access to the same kind of, up-to-the-minute research and standards of care that are done in hospitals. So if I come across a clinical condition that I'm not as familiar with, I would go to the National Guideline Clearinghouse in addition to looking it up to date, but to find a clinical practice guideline, say on the latest practice for managing constipation, in children in the outpatient setting, which is a huge problem, and is studies that continue to be done, so practice will change. I've definitely looked at the Cochrane database, but I haven't looked at the American College of Physicians or Physicians Information or DARE. So just know that they're out there and what they're used for. So based on what we've talked about up until this point, can you answer the following question? Which of the following sources of evidence would be the best evidence to use to suggest a clinical practice change? So I'm going to let you think about that and let me know what the answer is. Cinol is a licensed database, and that's another reason why I want you to use Cinol. I do not want you to use Google or Google Scholar because they do not filter their studies the same way that a licensed database does. And when you Google something, you can get research reports, but you can also get what's known as the gray literature, which is unpublished. Meaning, now it may not be bad, it may be a good source of evidence, but you have no way of knowing that. It has not been peer reviewed. I actually am in the process of waiting to hear about a manuscript I submitted to a peer-reviewed journal, and it's been over 4 weeks, and I'm still waiting. I'm told that's a good sign, but what happens is I submitted my manuscript for publication. They send it out to people like me to read it and review it and see if what I said in my article is true, to check my references, to make sure I cited everything correctly, and also to decide if it's worthy of publication. So that's part of the process that a research report goes through in order to make its way into a journal for us to find it and use it. So and that's what we find when we use licensed databases. If you use an unlicensed database like Google Scholar, you're finding evidence that hasn't gone through even that process. So that's not to say that you might not decide to include gray literature at some point in your life if you go on in your education. For example, I have definitely cited gray literature in some of my work because I haven't been able to find any studies, published studies, so I've had to cite the gray literature. I've found some unpublished dissertations that were relevant to my topic. But again, for this class and for this project, you don't need to go there, so don't waste your time. It's just important for you to understand the difference between the different search engines and why you would use one over the other. So getting into the nuts and bolts of actually searching the literature, you need to decide which of 3 ways you're going to go about searching. Are you going to use keywords, subject headings, or titles? I would stick with keywords. Again, I think that for this project it makes sense, and you can just use the keywords from your PICO question. If your population is children aged 3 to 8, then put that in the first search box. Put whatever the intervention is in the next search box and put the outcome in the third search box and see what you get, using and. If you get nothing, then put or in, or just search with one keyword at a time. But however you go about doing your search, make sure you keep track of how you did your search so that you can discuss that in that section of your paper. The other two types, subject headings search and title searching, have their strengths and weaknesses, but again, I would just stick with keyword. This slide here shows the strengths and weaknesses of the 3 search strategies, and it's a good thing for you to be aware of. Again, when you start doing more important work, especially if you go into graduate school, you are definitely going to have to go into more depth in your searching, and you may use various types of searching. But this is sort of a beginning level of evidence searching. So if you do separate keyword searches, then you can see what you have and then maybe combine 2 at a time. So maybe combine 2 keywords and see what comes out there, and then combine another 2 and then the other 2. And basically, though, for this paper, you just need 5 studies, 5 peer-reviewed studies written by nurses, published in peer-reviewed nursing journals to answer your PICO question. So you should be able to find 5. But don't find the best 5 you can find. So don't just get the first 5 you find, because that's not going to be good. And if you're showing me how you do your search, then I'm going to know you just picked the first 5. That's not how you do search. So you've got to search and look at the abstracts and look, at the sample sizes and look at the research question and determine, which of the 25 studies you find, which are the best 5. Next week, we're going to be focusing on how you determine which are the best. This is just a model of how you would search using the word and between your keywords, meaning that when you say and, you're only going to yield results that have both keywords somewhere in the article. If you use or, you're going to have articles that have one or the other keyword. We talked about limiting your searches. Remember, do not limit your searches to full text only. I promise you, you are going to do yourself in if you do that, because probably the best articles to answer your PICO question are going to be ones you have to get Andrew to retrieve for you. It's only a stroke of luck that the full text article is going to be there when you really need it. So do not limit to full text only. We, as a college, we are able to get articles from other libraries if we don't have the license to hold those journals. But we're part of a consortium and we can get them. So trust me, do that. It's good practice for you because you're going to have to do it down the road. You don't want to limit too much unless you're getting lots and lots of articles with your keyword search. So if you're getting, hundreds, thousands of articles by using just your keywords, then you definitely want to put some limiters in there. And I talked the other night about limiting by the date, the year of publication, limiting by the journal subset, making sure it's a nursing journal, peer reviewed. Um, you can limit the age group. Um, so there's different ways you can limit, but just do not limit to full text, please. And remember, the more you limit, the less results you're going to have. I just wanted to mention reference management software, just so you know what it is, part of, learning about evidence-based practice. I think you should be aware of what reference management software is. I didn't know anything about it until I started my doctoral program, and not until I was a couple of semesters in. And I wish I had known about it before, because it would have saved me some time. I actually now use RefWorks. I actually have a RefWorks and an EndNote account, but I basically use RefWorks. And what RefWorks is every time I find an article when I do a lit search that I think I'm going to want to use down the road, I can save it to my RefWorks account, and it's always there for me. The other things RefWorks does is it can create your bibliography, and you can also import RefWorks into a paper when you're writing your paper, and it'll populate your citations as you go along. So it's a really cool product. If you do go to grad school and you start writing lots and lots of papers, I would recommend finding out about RefWorks right away and using it, or EndNote. The sooner you start using one of those reference management software products, the better. So these, again, are all the different databases that, not all of them, but some of them that you can use when you conduct a search. It's good to know about them, but again, I really want you to stay in CINAHL. But the Cochrane database is where you're going to find systematic reviews. We talked about Medline. I'm not familiar with Embase. We talked about National Guideline Clearinghouse and PsycInfo, and I'm not familiar with TRIP. I'm just going to touch briefly on PubMed, even though I'm not interested that you use PubMed, but it does have some unique features. You might be interested in trying it out if you have the time. It has, 19 million sources, and it has some unique searching features that basically the chapter in your textbook goes into detail on. I'm not going to really go into detail on this presentation because it's not something you need to do for the course. But it does talk about medical search headings and explosion, meaning that you can type in a phrase and then hit the medical search heading button, and it'll link your phrase to a commonly used search term, so that if you worded it weirdly, it will turn it into a more searchable phrase that's more commonly used and help you get more articles. And I think that's a neat benefit, because sometimes we think we know what we want to search, but we're not sure we're picking the right words. So that's a good feature. CINAHL has a similar feature, and you can. It's called subject headings, but you can try that if you're having trouble. I think it requires a little more searching finesse, and I don't think you're going to need to do it, but if you do need to, I can walk you through it over the phone or in an online meeting. So again, I'm just going to quickly pass through these slides. So getting towards the end of the presentation here, and just to kind of stop and think about what we've talked about so far, here is a question. Which of the following online evidence sources is most likely to provide pre-appraised evidence? So hopefully you know the answer to that, because we talked about what pre-appraised evidence is, and that's one of learning outcomes of this week. So think about what the answer is to that. And even though pre-appraised evidence is considered the best evidence available, remember that it's not the only factor. A single research study that's done really well can provide excellent evidence. And, don't forget there's also clinical experience and patient preferences. We're just not focusing on that with our project. I talked about how I want you to keep track of your searches as you go along, and this slide is an example of a search table, and they're just naming the searches 1, 2, 3, and 4. But it shows that the first search they did was they used critical illness or critical care or ICU and found 204 studies. I don't know what the two numbers are. And so as you're doing your studies, your searches, jot down what your keywords were, what your Boolean phrase was, and how many results you got. And then if you change your search, put that as the second search. It will also help you to know what you've searched so far, because after you do it a few times, you forget which terms you put in already and which you didn't. So you should definitely keep track. In order to save your search history, you have to have an EBSCO account of your own. And that is way too complicated to do just for this course, unfortunately. So to wrap things up, remember that we have to have a good PICO question before we start our search. You can use subject headings when they're available if keywords are not working for you. If you're not getting enough literature, you can broaden your search or remove limiters, or you can try the explosion options on the databases. Use the search databases available tools that they have. I showed you the advanced search button on CINAHL, and I recommend you use it because it can make your search easier from the beginning. And think about the studies that you want to include to keep to help you answer your question, and what criteria you would use to exclude a study. So you may want to exclude studies of a particular gender. You may want to exclude studies that were done in a different geographic location, depending on what your issue is. Someone was asking about flu vaccine. Flu vaccine is an important issue in this particular part of the country, but isn't necessarily as big of an issue in other parts of the country. They don't experience a flu season like we do. So sometimes geographic location you want to use as an inclusion or exclusion criteria. You may want to exclude studies that had a financial connection with a pharmaceutical company or somebody else that there could be some implied bias there. So depending on how you're doing with your searches, when we get to the point after you've done some rapid appraisals of what you're finding and trying to determine which studies you're going to use and which ones you're not going to use, you want to think about establishing the criteria by which you're going to determine what you keep and what you don't keep. So that wraps up my lecture for this week. Sorry if it was a little longer than I anticipated. I think the 2 articles are really good. Again, I think you're going to have a really good idea about the search process from reading the articles. The chapter is also good. It's pretty short. It's pretty easy to read. It gives you a little more detail, more background on some of the concepts presented in the articles. So if you need more clarification on what you've read in the articles, definitely go to the chapter. And again, if you have questions, let me know. Keep up the good work, and see you next week.